Hey guys, this is Dr. Daigneault, and today I'd like to talk to you about a question that comes up on a regular basis. Matter of fact, last night we had one of our dinner. It's called the Dinner with the Duck, and somebody was asking Dr. Daigneault if I've had surgery, or somebody that I know they've had surgery, right? They were told that, hey, you know what? You should never have a chiropractor, right, check your spine, or you should never have somebody adjust you. And today I would like to address that because that was an amazing question. Right? Lots of people have been told that. They just don't know any better, or they're not sure and they don't know why. And so let me just kind of break this down just a little bit so you can understand. So at our office, we see lots of people that have had spine surgery, right? Either in their neck or in their lower back or whatever that might be. And people can see a chiropractor, no problem whatsoever, right? However, there's things that you'd like to keep in mind, right? That's the reason why we do an evaluation. And when a person comes to our office, right, it's not just like, well, we're going to have you get on the table and we just going to, you know, crack your back, right? I know that some of you right now, you're laughing because you're like, well, you know, that kind of feels that way. But what needs to happen is the first thing we need to do is we need to evaluate you to find out exactly what's going on with you and with your spine and what you've been through. And after a proper evaluation, what we do is we're going to report to you, but it gives us some time to be able to look at your case based on what you've been through, right? And what kind of spinal issues that you have. And if you've had surgery, do you have any, you know, hardware in there? Did you have a decompression? Did you have a discectomy? Is the hardware at the front of your spine? Is it at the back of your spine? Which area of your spine have you had the surgery? So once we can figure out all those things, right, then we have the ability to know exactly what can be done or cannot be done. And that is the beauty of being able to do a thorough evaluation first, and then we can find out exactly, you know, what's our next step. Obviously, if you've had fusion in one area of your spine, whether it's a natural fusion or whether it was done surgically, we would not touch those areas, but we already know in the literature, right? I want you to listen to this here for a moment. In the medical literature, those areas that have been fused above and below, they will start degenerating faster. So if you say, hey, you know what? If you're my brother, my sisters, my mother, my father, the one thing that I would want is I would want to make sure that if one area is fused, you would want to be looking above and below those areas to make sure to do the best that we can, right? To try to prevent further degeneration of those areas. That would be a good idea, don't you think? Right? I want you to say yes right now. Right? So that's the reason why once we do the evaluation, we can find out exactly what needs to be done, what we can do or cannot do. And just for the record, right, we see lots of people that have had surgery. They're doing great on their chiropractic care. And to be able to manage their condition long-term, you know, if need be, in many cases, some people will have chronic issues that can be managed chiropractically, and those people are doing very well. So, conclusion, if you've had spinal surgery, can a chiropractor, you know, can you see a chiropractor? The answer is yes, but you would want some of the criteria. You'd want a person that makes sure that they can evaluate that, they can take an X-ray of your spine, they can, you know, be able to figure out exactly what they can or cannot do. So hopefully this was helpful, and we will see you soon. Our phone number at the office, right, if you're one of those that have had surgery or you know somebody that have had one, our phone number at the office is 517-336-8880, 517-336-8880, or you can go on our website at achiro.net, achiro.net. We'll see you soon. Take care.